Good day, everyone, and welcome to our CGHI Interview Series. We're incredibly excited to be here with a very special guest, Christos Tsagkaris, one of our inspiring CGHI member. Hi, Christos. Thank you so much for joining us today.
Hello, thank you very much for the invitation and for having me on this series of interviews.
Thank you. And for those who may be new to us, this series is our way of introducing the individuals behind CGHI. Through these conversations, we aim to share their stories, lessons learned, and the motivations that drive them on their global health journey. It's a chance to spotlight the people who make our community what it is: passionate, diverse, and committed to impact. To briefly introduce myself, I'm Kim, the social media manager of CGHI, and today I'm joining from Lima, Peru. Nicole, would you like to introduce yourself?
Of course, and I'm Nicole, co-host of the CGHI Interview Series. I am joining today from Washington, D.C. in the United States. Today, we are excited to speak with Christos, a medical doctor, health advocate, and global health professional whose work spans clinical medicine, youth engagement, science communication, and global policy. We're looking forward to hearing about his journey into global health, what drives his work, and how he sees the role of young professionals in shaping a healthier, more equitable world. Christos, to start, would you like to introduce yourself further?
Certainly. I'm a medical doctor. I come originally from Greece, where I studied in the University of Crete. And after my studies, I moved to Switzerland, where I'm training in orthopedic surgery. In the meantime, I have also had some postgraduate studies around healthcare administration, international relations, and global health as part of this. And I have also had the chance to work with a number of health institutions in Europe, as well as with various health organizations, mainly civil society organizations run by youth or by healthcare professionals. I often feel like a passenger in two or more boats, but my main boats would be clinical medicine and, as an extension to them, clinical research and also public and global health and relevant advocacy.
Oh, thank you, Christos. And let's go back to the beginning. What inspired your journey in global health? Was there a particular moment or experience that sparkled your passion for this field?
Well, that's actually quite a funny question for me to respond in the sense that I think that this inspiration goes back to a point that I didn't know what global health is, or even more, if global health exists. So it was actually my very first day in medical school and literally my first class, which happened to be a lesson or a subject called society and health. It could be the equivalent of public health. And I joined medical school in September 2015. It was a time that there was a public health emergency of international concern around Ebola. And the professor who was teaching the class thought that it would be a very good introduction to us for our very first day in medicine to talk us a bit about epidemics, pandemics, preparedness, and so on. I found it quite interesting in the sense that I'm also a fan of history and I have read a lot about the epidemics of plague and so on. But after a while in this class, I realized that it is a science per se and not just a historical reference. Um, there was, of course, a lot of time that I continued to ignore the existence of global health or to kind of confuse it with public health or with health affairs and health policy. About in 2020, during my fifth year, on one side we had the COVID pandemic. There, I believe that everybody became literate, and there were two milestones that really inspired me to stay active in this space. One was being one of the co-founders of an initiative called Students Against COVID at the time. Then it was literally a global platform that was advocating, creating resources, and bringing together individuals from the global north and the global south to tackle a global health problem. So in a way, I started learning by doing, and at the same period, I also had the chance to apply for a global health mentorship through the Multipod initiative, where I met Dr. Tsagkaris, the founder of Multipod, and my mentor then, Dr. Mazin, who introduced me to officially and formally to the world of global health and how research is done there, and so on and so forth. So this could be the main inspirations. Of course, by saying this, I am unfair to many people that were there in this trajectory, were already working on global health. And after going through these experiences, I realized that they are doing quite relevant work, and I need to talk to these people. Some of these people, for instance, like Dr. Petelos or Professor Leonis, were already in the faculty I was studying at. But let's say that my inspiration was learning that global health exists and that it aligned with some of my previous interests beyond, let's say, quite precise clinical medicine or beyond biology and so on.
Well, thank you for sharing that. And it is interesting how your work in medicine has, opened up your awareness of global health. So you've worked across many global platforms, and looking specifically on youth engagement in health policy, how have those experiences influenced your views on that, on youth engagement?
These were quite, let's say, really shaping, and I would use the term assertive experiences in the sense that most of us have been through some type of medical studies, and first of all, we are overwhelmed by the volume of information and also the volume of uncertainty that we are facing. But if we look at most educational curricula, there is a big focus on biological sciences that is then preceded or that is then succeeded actually by a focus on the clinical part, where of course young people, students or junior doctors cannot play a very decisive role in the sense that you need experience, you need knowledge, and as a young person, you are the one who has to learn and to literally invest time and efforts into this. However, there are several platforms that look exactly for young people, young professionals in the healthcare space, and they are looking not for the experience that young people don't have, but actually for the lived, let's say, opinions, for the lived experience that young people and their perspectives, their affinity to technology, their own take of social problems or their own living as young and uncertain individuals that still have a lot to learn and a lot to explore provides them with. So I got the chance as a fourth year med student to be part of the youth advocates, essentially youth ambassadors of the Association of European Cancer Leagues. This was one of the first chances where I realized that young and inexperienced students can have a voice within the healthcare community, but also within the broader European health policy community. As a student, through this experience, I had the chance to deliver workshops and conferences, to even deliver a talk in a number of European NGOs, which was not something that is a standard or is what you expect as an inexperienced student who still tries to figure out which are the normal values of this or the other parameter. And of course, there are a lot of experiences and a lot of programs that I would also suggest. For instance, the ECTOF conference, the European Conference on Tobacco Health, they set an example by setting a youth task force. Almost all the fields like medicine, pharmacy, dentistry, nutrition, and so on have their own youth organizations. And most importantly, there are transdisciplinary organizations based on a specific disease or on a specific take on health, like the coalition is as well, that welcome young people and provide them actually a space to learn, but also to contribute as stakeholders and not only as, let's say, young and evolving wizards.
Wow, that was really a thoughtful answer. Thank you, Christos. And I think our audience, there's so many young professionals, gonna definitely appreciate that perspective. And which leads to the next question. With your background in clinical medicine, how do you balance the demands of medical practice with advocacy, research, and leadership in global health? Like, what are some of the tension you've encountered?
Well, it's not actually about balancing, it's about finding and maintaining the alignment. One role, each of these roles informs and complements the other. Of course, it might be not easy. There is a lot to learn in both fields. In the clinic, you are overwhelmed but also humbled by the chance to take decisions that have a very direct impact on a person that stands or even lies in front of you. And especially in surgery, I work in orthopedic surgery, you get to realize that it's not enough to just study and understand. You have to be able to translate this knowledge into practice. Practice differs from person to person, so you have to develop interpersonal skills and you have to make sure that you remain critical enough to find what works better in your setup and in the circumstances you're working in. On the other hand, when you are more into health affairs and so on, you have the chance to think more spherically. You do not have a specific person, you have a broader landscape, you have a population healthcare perspective. You also have the chance to avoid giving a direct answer here and now. It's not about how many milligrams of this medication are we administering or whether we are using a plate or a screw of this diameter or of this length. It's about setting, let's say, the scene, setting the groundwork, and understanding the field. So at the end of the day, I think that the clinic has helped me in seeking precision, understanding that no matter in which context the question is posed, at the end of the question we have people who need a specific answer and a specific solution in their setting. But on the other hand, not being a leader, but being a person who learns through global health or public health in Europe and health policy, I also came to realize that there is not always a right response. On the contrary, we need to adapt ourselves to an ever-changing landscape and think beyond what we see with our glasses or in front of our nose.
Thank you. It's interesting to hear how the work that you do is so dynamic and you're putting it within context, not just clinically, but also globally and like within the moment, focusing on certain patients. Among your broad background, you're also deeply involved in science communication and public education. Why do you think this work is so important in today's health landscape? And what approaches do you find most effective in regards to communication in reaching broader audiences?
Well, we live in a world of noise, and if we want to survive in this and have a chance of taking our knowledge and our practice one step further, we unfortunately need to be louder or the loudest in the room. We do not have to shout, but as you mentioned, we need to use appropriate techniques. So first of all, science communication is important because we cannot take it as granted that everybody understands the importance of science, and everybody goes from lay people or the general public understanding, for instance, why vaccines or medication is necessary in the context of a pandemic, but also why preventive measures are also necessary in the context of preventing cancer right now, 5 years after COVID, and when more or less we have forgotten about this, although this is not the right take. And from these people, it goes all the way to policymakers. Policymakers have a full agenda, and health science is not necessarily on top. On the contrary, health science can, to an extent, not essentially destroy, but take a political agenda backwards. For instance, regulation on tobacco, on alcohol, or unhealthy food is something that can make one unpopular. Actually, being a person that talks a lot about this, I believe that I have become a bit more unpopular than I used to be. And if one is a politician, for instance, putting themselves in conflict with not only the industries but also the people whose living depends in one way or another from the functioning of these industries, then one has a high cost to pay. And there are, of course, a lot of cases of healthcare or health coverage that are not, let's say, detrimental per se in a political way, but are not also politically profitable. For instance, cancer prevention is an investment in time. If we put together the right measures now, we will probably harvest their investments in 20 years. And it's all the way the same to, for instance, establishing a hip dysplasia screening program. The results will be seen in the next generation, and someone who has a limited time as a regulator will be gone by that time. So we have to actually be able not only to advertise, but actually to persuade and actually to inspire people to commit to such causes that go beyond our lifetime or our career. Essentially, it's what was all the time, as Hippocrates had said it, our art and also our communication and advocacy from written text, communication through peer-reviewed media between our own profession and broader communication through social media, electronic media, and also creative manners, like, for instance, memes or podcasts or reels. And all these, they are about topics that are longer than our own life. The art of medicine is longer than the brief human life, but this is how it goes on. We communicate this and go forward with this.
Oh, that's very insightful, Christos. We need to be loud, to be seen, and to be acknowledged, and in order to make some changes, no matter for us or our next generations. And now I would like to ask, looking back on your work so far, is there a project or initiative that you're particularly proud of?
I'm not proud as a person for myself, but I'm certainly proud for the people I got to meet through a series of projects, and also what could be impactful or at least what stayed down in words. There are two quite, let's say, closely aligned in time, but also in terms of learning of global health moments that I'm very happy for, and one could also say proud. One of these could be the Manifesto on Cancer Care in Conflict Settings, and another one that took place almost around the same time was the Madrid Declaration for a Tobacco-Free Generation in Europe. They stand out, let's say, as we talk. Both are more than policy papers. Both were formed through international conferences that brought together the senior leadership of the WHO with young students and young professionals. And all of them lay down a strategic framework that addresses two key issues that go on at the same time. For instance, on one side, cancer care in conflict regions. We have a lot of conflict affected regions. And at the same time, I, for instance, live in Europe. I live in a space that is safe from war, but is not safe from the influence of an unhealthy way of life that at the end of the day battles against health and well-being. So two major conferences, a great group of people, and an output that stays there, goes forward, and helps us learn and helps us take the message forward.
And so building on your work, and I think you have already shared a lot of great advice, particularly when you mentioned being committed to a cause that spans perhaps greater than your own lifespan, and being committed beyond any political influence of that as well. But the next question we wanted to ask you, though, is what advice would you give to young professionals or medical students who want to explore careers beyond the hospital in clinical practice, particularly in global health, health policy, or advocacy?
A cliche advice would be start small, be a beginner, find the communities or the chances that challenge you outside your comfort zone. Um, I think that everything that we are doing in the healthcare space is a direct and daily challenge to comfort zones and so on. I think that my advice would be starting small, but also staying curious, and when the time comes, being bold, and at the same time remaining humble. How now we disentangle this? Concretely, for a young clinician like me, or for me, let's say 3 years ago, I would say that one should not think that staying into the clinic closes the door of global health. On the opposite, these are totally compatible roles, and in my opinion, it's something that one needs to have in their mind. Like being into the clinic is a humbling experience. It teaches us our limits, and it also informs us about pertinent problem and how they really look on the field. So actually, being a clinician who is interested in global health could also be a benefit. On the other hand, I do think that being into the clinic gives us certain skills that can be translated into global health. So I would advise people to cultivate skills like precise thinking, like precise articulation, be it, let's say, an indication, be it an etiology, be it an explanation. And most importantly, being into the clinic teaches us how to explain technical terms to lay people who only want a solution to their problem. And this is what we need to do when also analyzing public or global health challenges to the public or to policymakers. So if we can make it more concrete, I would say keep both in parallel, do not postpone. This is the time for both, and make sure to be concrete in both. Uh, set realizable goals on both and pursue them at the same time because they complement each other.
Thank you for the advice. I think our audience is going to appreciate all of this advice. And on a related note, would you please share how CGHI has supported your global health journey?
Absolutely. Actually, the story starts again before I knew about something. In this case, before I knew about CGHI. When I joined the multi-pod mentorship program, I got to know Charlie, the founder of GCSI, as the then program administrator for the multi-pod mentoring project. And I already talked about the mentors I had there, but I believe that we also talked about all of us, younger people or less senior people, acting as a peer or as a mentor to each other. So I got to learn a lot about Charlie as a person who has lived and studied in more than 3 countries at the time and was continuing studying what she wanted. I was a student in Greece back then, and although I had some students exchanges, I was mainly in one place. And then I saw that people can study and work in different countries and settings. And most importantly, then 1 year later, Charlie started the organization. And with this, I saw that one can go forward with their studies, with their job, and so on, but they can still put together an initiative and put it together in a manner that remains structured. So the CGHI, for all of the people that listen to us, is a community that provides a very wide range of contributions to global health. It's, first of all, a series of educational webinars and workshops. It's community meetings where we actually become the educators, or we become the actors that shape the agenda and put the goal together. And of course, it's a network of people where you can reach to geographically, but also in terms of, let's say, specialization. Like if you need to talk to someone who is into a specific part of global health or a specific methodology, and is based from all the way from South Africa to Argentina, then you know already a person. So I think that CGHI is an enabling and affirmative community which I am happy to be a member of, and I also recommend people to join.
Wonderful. And speaking of groups and people who have inspired you, we wanted to ask who has had the greatest influence on your career, any mentors, and what lesson did they leave with you?
Well, I will not respond to this because it will be unfair.
Okay. It doesn't have to be
You know,
one.
the most difficult actually thing in public health, or what I find most difficult within all statistics and so on, is evaluation systems, or how you can, let's say, measure in a way that is comparable and interoperable. I have been influenced by many people, both in the clinical and the non-clinical space. I will just give a very short timeline, but giving that time unfair to many other people that had quite an important role in this. I had I had the chance to meet quite good clinicians in Heraklion in Crete, where I studied, one being the professor of gastroenterology and my mentor in the medical school, another being the now rector of the school, the professor of hematology, one more being the professor of neurosurgery and his successor, who actually told me that if you want to know something, you have to be able to operate on this. And he's actually the person who showed me the way into a surgical, let's say, field later on. Also the professor of public health and community health, and one of his close collaborators that is based in the Netherlands. These are few of the people that influenced me in my undergraduate studies. And now in Zurich, I had at least 3 or 4 people that have served as my chief physicians, have been examples in their own ways. And I have a special gratitude for the people in the pediatric hospital where I worked in pediatric orthopedics, that actually showed me that being an orthopedic and doing all these things at the same time is something that is compatible with orthopedics per se, and probably something that is desirable as well. And there are just too many people that I would mention. People from conferences, people from the European space that have all put, let's say, their own stone, as we say in Greek, in essentially enabling and persuading people like me that we can do what we are thinking of, we can learn one way or another, and we can continue trying. So I will not name one person because it will be unfair.
Yeah, I can totally understand you, because you mentioned the people and the system that make you feel so grateful, and it's really hard to just name 1 or 2 person, and I understand. And also, is there a book or film that fundamentally changed you? Like we already talked about the people and the system, and then is there some art changed you?
Yeah, there I can give a name. Well, one of the books that I most liked as a child or a high school student was The World of Sophia. I read it in Greek back then. It's actually a novel written by a professor of philosophy, where a girl called Sophia, which is actually the Greek word for wisdom, has a chance to travel through different periods through some notes or some CDs and so on, meet philosophers, innovators, scientists, and so on, and talk with them. Um, I think that this taught me that one can and should pursue a direct dialogue with sources, a dialogue with the authenticity, a direct dialogue with the experts, a direct dialogue with the stakeholders. And being a young person with a lot of questions is not something that one should be intimidated for. On the contrary, it's something that one can use. Being young people, and this was the key takeaway of this book for me, is not a disadvantage. It actually offers us the time to learn a lot and then plenty of time to use these learnings, not only in philosophy, but also in applying philosophy to many other parts of life.
Thank you for sharing. It sounds like it really influenced or give you some touch in your heart, and it shapes who you are. And I find that's really beautiful. And thank you for sharing. I think today's question we're finishing. And thank you so much, Christos, for sharing your stories and insights with us. We really appreciate your openness and honesty you brought into this conversation. It's a reminder of the many paths that can lead to impact in global health and the value of bringing your full self, your voice into the work. And thank you so much.
Thank you for taking the time, both you personally, and thank you to you as part of CGHI for providing this platform.
Yeah.
I look forward to listening to other interviews from the same series.
Thank you, Christos. And the impression that I'm left with is you bridge many different disciplines, and your extensive background speaks to that. And I really, I think that we can, and the people listening can learn so much from you. And notably, the importance of not segregating global health and clinical practice, and having a bridge and integrating and aligning both of those things, and the importance of communicating effectively, and the inspiration to stay curious and ask questions and be humble. So thank you again for your time.
Thank you very much.